We'll get Dr. Rachel into the conversation because Dr. Rachel, fast forward a bit, in 2010 you became Rebecca's doctor.
Yes.
Yeah, absolutely. I mean, that's where my HIV space of career started. Is I went to the West and I worked with the team in the West, and she was one of my very few patients back then. And like in the Western Division, we started off with I think 10 individuals who were living with HIV there, but within the year that escalated. And honestly, that time, it like I mentioned, so much has changed about HIV that, like, I think Rebecca herself had kids who went through that PMTCT, the Prevention of Mother to Child Transmission program, and had negative children. And that's a value right now. I mean, that's so important. And last year alone, I forgot to mention, we had 4 newborn babies who came out to be positive. And that's uncalled for. And we've got programs within right across the country that allows that if a pregnant woman is positive, they go through this program and the child can be negative. We'll
talk about testing, and you said voluntary testing was available back in 2006.
Yes.
Is it still available if you're pregnant and you go for your clinics?
Yes.
Absolutely. I mean, testing is available actually for the approximately 20,000 deliveries we do in a year. Testing is available for every individual, all of them.
But isn't there an issue also that there's a lot of new mothers or mothers who get pregnant do not attend clinics?
That is one of the contributing factors. Like, apart from testing being made available, some would we'd love individuals or women who are pregnant to turn up to the clinics in the first 3 months of pregnancy, at least to start that off. The first trimester, we say. That's the best time. And then we test them if they can't turn out positive. And it's not just HIV, but it goes to syphilis and hepatitis as well. And we go through them the necessary treatment. But we see a good number that either don't turn up. And these are usually seen amongst women who have a few children, because sometimes I guess it's the confidence that gets in. I should be fine and I can go to the clinic later. And we've actually had individuals, women who've walked into labor unbooked as well. So that has been contributing factors as well. And that can contribute to this sort of scenario.
So you're saying it's easy to get tested?
Absolutely.
When it's required, where can people go, those watching?
So for those watching, generally HIV test within the ministry, within public, private, both can walk into any clinic and ask for a HIV test. But we've got special clinics in the country that is in the Western, Central and Northern Division. It's a sexual reproductive health clinics, and it's very adolescent, youth friendly in the places. In Lotoka, Suva in North, and basically almost in town, where they can just walk in, ask for a HIV test, and get a result soon after. And we are moving towards point of care testing now, where we're trying to make sure that, for example, if a person walks in to me, sees a medical doctor or a nurse, gets the test, and within the 20 minutes or so, they're likely to get a result back. So this is the point of care testing that the ministry is really moving towards. It's something that may not be done in private right now, but we are definitely ramping up these opportunities for individuals.
So with the testing and with the issue going back to mothers who are leaving things late, or who may think it is okay, maybe I don't have it, or I'm in a relationship and we believe that it's okay and it shouldn't be an issue. What is your message from both of you?
To be very honest, the only message, the very important message I will relay out there is, I urge all pregnant women.
Actually, partners as well.
Yeah, and partners as well, of course.
Yeah, well.
Definitely, just urge you all, please come out, and as soon as you find out that you're pregnant, come into clinic, come in for antenatal, come and get a test. You never know what your partner has been doing. You never even know. Maybe your past, that can have a contributing factor to where you are today. But just come out and get a HIV test. We definitely and strongly encourage all pregnant women, and have the support of your partners as well, so that you come out and get a HIV test. That is a very important part.
Dr. Rachel, is there a number that people can call if they want they want some direction before they go over. Are we looking at something like that?
We can definitely share numbers in due time. I guess we can definitely put that up. It can come up on our Ministry of Health page, which associates the clinics that we've got. But like I mentioned, Vijay, any individual can walk into any health facility in Fiji and ask for a HIV test. And honestly, without doing a test, you'll never be able to know your status. Absolutely never. I mean, this is such an important aspect to HIV itself, the HIV response in Fiji.
And sorry, if I just may add on to Dr. Rachel, besides getting into any clinic and doing a HIV test, it is confidential.
Yeah, absolutely.
It is confidential. That is a major part of it. This testing, it is confidential.
And apart from that, one thing I really want to emphasize on is don't just come in and get a test, come back or get that result.
Right.
There's a good number of individuals in Fiji who've gotten a test done, but unfortunately for some unforeseen reason haven't been able to walk back and get that result from the clinics.